Good day. This is UNTH Educational Series. I am Ikeme Ogechukwu, an Assistant Director of Nursing and a Fellow of the West African College of Nursing. Today we are going to talk about sickle cell disease. What is sickle cell disease? It's an inherited disorder of the red blood cells. The Igbos call it Obanje because they didn't understand it. The Yorubas call it Abiku because they didn't understand it. But in English and in medicine, it is called sickle cell disease, an inherited genetic disorder. Inherited in the sense that the normal red blood cell, which carries oxygen in the body, is circular in shape. But in a sickle cell disease, the red blood cell is curved like letter C. And that C depicts the shape of a farming tool known as sickle that is shaped like C. So because the red blood cell is shaped like C, and imagine it passing through a vessel, just like a water canal, which is the blood vessel. Those C-shaped red blood cells will hook on the other, causing blockage, and this will stop blood from flowing to the vital organs of the body. A normal red blood cell in a healthy individual lasts 120 days and is being destroyed and a new one comes up. But in a sickle cell disease patient, the red blood cell lasts only 10 to 20 days. And because it lasts only 10 to 20 days, you see them, their eyes are yellowish because there's a lot of hemolysis. When red blood cell is being broken down, bilirubin is being excreted, and that is why it deposits on their pigments. Now, what are the signs and symptoms of a sickle cell patient? 1, they have pain, which we call bone pain crisis. They have hand and feet syndrome, which is caused due to swelling of the hand and the legs because of poor peripheral perfusion and return of blood. Now, they have yellowish discoloration of the eyes because I said there is early breakdown of red blood cells, which causes hemolysis, and those yellow cells is being deposited, yellow pigment, which is being seen as the red blood cells are being broken down. So it makes them look yellowish. And they have anemia. That is why it's called sickle cell anemia. They have anemia. Now, how is sickle cell transmitted? It is not infectious. You cannot get it from talking to somebody. You get it by genetic dispositions. That is where genetic counseling comes in. When you are AA and you are married to an AA genotype, you will have no business with sickle cell disease. But when you are AA and you marry an AS, there is a possibility that you might have a baby that is AS, that has that sickle cell gene. And when you are AS and married to an AS, the chances are high because you will have a baby that is a sickler, the same way with marrying an SS when you are an AS. Now, how do we know the complications of this sickle cell? There are a lot of complications: bone pain crisis, hand and feet syndrome, even stroke, even acute chest syndrome. In acute chest syndrome, they experience this chest tightness, weakness, pain. They cannot breathe because once the red blood cell that is sickled has lodged into somewhere, it will block blood from passing through the normal channel. That is why they have crisis. Even for stroke, how do they have stroke? When the sickle cell is now blocking a blood vessel, blood doesn't get to the brain. it can lead to stroke. Those are the complications. How do we prevent sickle cell disease? We prevent sickle cell disease by genetic counseling. Before you talk about falling in love, first of all, know the genotype of the person you are dating or you are in a relationship with. Because when you keep it as the last resort, by then it's already late. You will now fall into love and say that it doesn't matter. We can still marry. It's love. At the end of the day, who suffers it? The baby suffers it. A once blissful marriage will be turned into a mess. Because when your child is in crisis, you as the man, you're not happy. You as the woman, you are not happy. So we can prevent it by early genetic counseling. How do we do that? You make sure that once you give birth to your child, before the child gets to the age of 6 months, check the genotype of that child. Sound it in the ear of the child. You are AS. You shouldn't have anything to do with an AS person. Or you are a sickler. You shouldn't have anything to do with an AS person. But once your child is AA, there is no problem. Once your child is AS, tell the person that the person has to marry a person that has AA genotype to avoid sickle cell disease. That doesn't mean that people that are sicklers, they will not get married. They will get married, but they will have to marry people that has genotype of AA, so that if worse comes to worse, they will have AS children and not sicklers. When somebody has AS, it means that you are a carrier. The person will not have the crisis and the complications of sickle cell. Now, let's talk about management of sickle cell. How do we manage sickle cell? Once a child is a sickler, you take care of the child by advising the child on adequate fluid intake. The child is supposed to take up to 8 to 10 glasses of water in a day. It helps to reduce the blood viscosity so that the blood can flow freely. Imagine if you have enough water in the blood, it will help the sickle cell not to gum in with each other, not to clamp with each other. It will help it to flow freely. And when it's flowing freely, the rate of crisis will be reduced. Another thing is that we have to always advise them to visit the sickle cell clinic, because that is where they see the doctor, they are being monitored, they do the necessary tests so that they know how to manage the child. They give the routine medications that they take, which helps them to control the condition. Another thing is that they should avoid stress. They should not be in a stuffy room, because once they are stressed, in a stuffy room, the red blood cell, remember, it carries oxygen. Once there is low oxygen, they might even go into crisis. So, how do we treat sickle cell? Is there a treatment for sickle cell? So far, there is no treatment for sickle cell, but some have even gone to the extent of bone marrow transplant, which has helped them, but it's a risky procedure. So in case of any inquiry, you can contact us on the line number showing on the screen, or you can visit any public health facility near you for more advice. Thank you very much. My name remains Ikeme Ogechukwu. Thank you.